Welcome, everyone, to the Final Brand Podcast. This is your host, Grant McGaw, and I am so happy, so very, very happy to be talking to my colleagues, my peers, my friends over at Jackson Health System. And we've been going through a program, my program, the Brave Framework for Brand Strategy. And I've talked to Mavel, and I'm going to tell you something. Talking to Mavel, I just had to sit back a lot of times and just listen. Just listen as she detailed her story about why she is in the field of healthcare and why she's making a difference in what she does. So, I'd like Mavel first to introduce herself. We're going to have a great conversation about this journey. So, Mavel, tell us a little bit about yourself.
Hi, Grant. Thank you so much for having me this afternoon. And I am so grateful to be part of this program. My name is Mavel Arinal. I'm the corporate director for clinical practice and regulatory compliance here at Jackson Health System. So one of the things that my leader had really have a goal for us is to develop us, which is why I am here. But I'm very fortunate and grateful to be part of this program. So thank you so much.
You're most welcome, very welcome. And we want to start off with your journey about, if I might ask, because you come from a far off world as far as I've never been there, and I want to know a little bit more about the Philippines and things of that nature, and your world and where you're from. So let's start with your journey. Tell us one defining moment from your early days as a nurse that shapes how you lead today.
Well, my journey began in the Philippines. I worked there as a labor and delivery nurse. It was such a privilege to be part of life's most vulnerable yet precious moments. Those experiences taught me that real leadership is rooted in empathy, in attention to detail, and unwavering care. But moving here to the US, however, brought a whole new chapter that shaped me even more. I took a humbling step back. I worked as a certified nursing assistant in a nursing home while adapting to a new country and studying tirelessly to pass the NCLEX. So those experiences really reminded me of resilience that is required to start over, but and the dignity in serving others. And it instilled adaptability, integrity, and strength in me, qualities that still up to this day I uphold. And it also reminded me that no matter where the journey begins, it's the dedication and heart you bring to each moment that defines your path and your leadership.
Well, you've certainly done that. You have defined leadership in such a way. One of the things we work through is coming up with a brand tagline. What I think is so apt, and this tagline is MA, lead quietly, change everything. And when I think of you, you emulate everything around that. Now, you've made a remarkable shift from bedside, as you talked about, to boardroom. The question I have for you is twofold, but what mindset or habit helped you make the transition successfully?
It all began with curiosity, actually, and a willingness to embrace new opportunities. I vividly remember asking our nurse educator one time, she was about to go on maternity leave. I asked her if she enjoyed what she did. That simple conversation ignited my passion for education and inspired me to volunteer to step into her role while she was away. It was during that time that I discovered how much I loved guiding and empowering others, helping them grow in their skills and confidence. That experience was my first glimpse into the transformative power of education, not just for others, but for myself as well. And then when I later led my first clinical trial at West Kendall Baptist Hospital, my passion for education expanded even further. I realized that research is, at its core, a form of teaching. It's about uncovering evidence, translating it into an actionable knowledge, and sharing it to improve care and outcomes. But whether I'm mentoring nurses or implementing evidence based practices, I see education and research as two sides of the same coin. Both are driven by curiosity, collaboration, and a commitment to make a lasting impact. I never realized it at that time, but my passion for teaching, my eagerness to learn, and drive to uplift others allowed my leaders to see something in me that I hadn't yet recognized in myself. Their faith in my potential, coupled with the confidence I slowly built through the experiences, gave me the courage to take a leap from the bedside to the boardroom, grounded in purpose and clarity.
Well, I tell you one thing, and you're very, very modest in your approach because you've built a brand about quiet strength and strategic precision. And as I stated, your brand tagline, lead quietly, change everything. What does that mean to you now?
It means leadership is not about being the loudest voice in the room. It's about leading with intention. It's also about observing, understanding, and making decisions that create meaningful impact. For me, quiet strength is steady, not flashy. And true leadership doesn't need to share or to shout to inspire change. Instead, it's about building trust, empowering others, and staying grounded in purpose. When challenges arise, quiet strength helps me to stay calm and clear, guiding teams with trust and focus rather than grand gestures. It's a reminder that leadership isn't about demanding attention, it's about earning respect through thoughtful, deliberate actions.
Mm. And you, well, we went through this whole process, and I found that you live what I call it's like almost a cul-de-sac. Some people live at an intersection. You live at a cul-de-sac, meaning there's three things that come together that are unique to you and your particular personal brand, and that's around education. It's around clinical applications and then compliance. You don't see those three things a lot. So, I mean, in the same embodied in the same person, and that you can operate at those levels very effectively. So, in your role at Jackson Health, you've led some pretty complex initiatives. Can you just walk us through like a moment where, compliance, culture, compassion, that trifecta really helped you in your leadership?
Well, one pivotal moment where compliance, culture, and compassion intersected in my leadership was when I started the Vascular Access Management Initiative. This is a big project. It's still an ongoing project, actually. The goal was clear to ensure compliance with national standards and organizational policies to improve patient safety. However, the journey was far from simple. The staff were deeply rooted in long-standing practices they felt comfortable with, and the variety of products being used across the system added the challenge of creating and supporting consistent and evidence-based practice.
Mhm.
When I led this initiative, it meant really connecting with leaders and stakeholders across the system. I knew how important it was to align their perspectives and get their support to make it a success. The conversations we had weren't just about presenting a clear strategy, they were also about truly understanding the different challenges and priorities for the team or the teams and organization as a whole. So I also made it a point to approach the teams with compassion, knowing that change can be overwhelming and even uncomfortable at times. My goal wasn't just to implement new standards, it was to guide everyone through the process with empathy and encouragement. While the journey isn't over, I've been able to foster collaboration, drive meaningful change, and uphold the commitment to create safer practices for our patients and teams alike by listening to their concerns and validating their experiences and building trust.
I tell you, because you have that viewpoint, and more importantly, you have the experience, and that you can help others and you can translate to others as you take on these high visibility projects that you've been part of. One of the things that I discovered, or we discovered together, is that in your brand blueprint, your position as what we call a sage, right? Like a real good teacher, and then a caregiver, and you blend those two together as a hybrid. So the question is, how do you balance, your empathy with accountability in high stakes environments, just like you just described? How do you do that?
I believe finding balance starts with listening deeply and responding thoughtfully. I focus on building trust first, making sure there's a solid foundation to work from. And at the same time, I hold myself and others to high standards, but I never let go of compassion in the process. So it's all about staying grounded while keeping things meaningful and intentional. So for me, accountability is what makes sure we hit our goals, but empathy is what makes the journey to those goals meaningful and human. Especially in high pressure situation, I've learned that finding the right balance between the two leads me to lead with integrity. It's also how I build trust and inspire confidence in the teams I work with. It's about staying focused on results without losing sight of the people behind them.
Well, again, you're very modest in how you bring that together and the impact that you leave behind. My mother used
Mhm.
to say, speak quietly but carry a big stick. And that's leaving the impact that you have. And you've been doing that very effectively for a while, especially when you transition from Baptist over to Jackson, and then what you're able to then become in the time that you've been with Jackson. Now you're committed to elevating compliance. You're big into compliance from a task to a strategy. My question is this, and here's the question. How do you see the role of compliance evolving in the next generation of healthcare leadership? Because you've been there, you've seen it, but you also seen the change that's occurred I think a lot of people don't understand compliance. So first, if you would, how do you define compliance? And then answer that question, how you see it evolving for the next generation of healthcare leaders.
Thank you, Grant. Yes, compliance really play a big role in, especially in clinical practice, right? Not just clinical practice, but I'm thinking compliance is now evolving into a key part of leadership. It is a real driving force for safety, equity, and excellence. So thinking about that, it's not just, about following rules anymore. It's about actively creating systems that put the well-being of both patients and staff front and center. So leaders will need to tie compliance to actual outcomes. And sometimes we are so focused on the outcomes, but then uh, there are challenges along the way, and compliance really play a big role on the outcomes, making sure policies align with the real world impact they have. So it's really about changing how we see compliance from something obligatory to something full of potential and recognizing it as a tool that can truly transform healthcare and not just, something to obey or follow because it's there.
You said that right. There's a reason why you have to, we're looking to be more compliant, because in a hospital environment, there are lives at stake. We don't do things the right way. The outcomes aren't as good as they could be. So we appreciate a person like yourself, behind those scenes, doing those things that make such a big difference in what you do. Now, one part of your journey that stood out was your time in research. And I think research is part of my BRAVE framework as well. We talk about brand identity. we talk about research, we talk about assets, we talk about visibility, we talk about execution. Research was big, for you. So how did that experience inform the way you approach evidence-based leadership?
Well, Grant, I could tell you that hearing research before in my earlier years in nursing, I get scared when I hear about research. But that really changed when I led the first clinical trial at West Kendall Baptist. From that experience, it taught me to never stop searching for answers, to continue to always ask questions. From that experience, I was able to understand that data can be a powerful tool. And it showed me how powerful evidence can be in guiding decisions and begin and building the trust, right? Whether I was analyzing data or putting findings into practice, I saw how research could truly transform patient care. And it has made me a more thoughtful and intentional reader, someone who leans on both insight and intuition to make a difference, really. So I do enjoy doing research, and I'm hoping and wishing that nurses, especially, are not gonna get scared anymore of being involved in research, because truly it is something that we can do to improve our practice and to strengthen our practice.
I believe in that. That's how you can limit certain things like infection, hospital-acquired infection, things of that nature. That you don't want to, come in with one thing and walk out with a whole nother thing. Especially you do your research, as you said. I know I learned a lot, especially when I work with another client of mine named Joy McMillan. Is that you could be in a hospital, you can touch a button in the elevator, and you don't realize that you're walking away with, unless there was some kind of infection control that was taking place, that the simple thing is just being in an elevator could expose you to certain things if you're not aware of these things and how because and luckily for you, you got the compliance, you got the research, you got the knowledge, like, hey, we need to do these things. And if we do these things, we can improve our total overall outcomes. Now, in my question around what you've done, you've gone through my program, you've gotten the brand assessment, you've got the skills gap analysis, you've gotten the brand blueprint strategy. So you now have a 360-degree view of your brand, your goals, and your market position. The question is, what was the most surprising insight that you came out of with your branding journey?
First, I want to tell you that I enjoyed your program, Grant. And second, the biggest surprise was really realizing how much leadership is about connection, not just with teams, but also with purpose. I learned who I am as a leader is not defined by titles, but by the impact I make and the trust I build. It was eye-opening to see how quiet, deliberate actions often carry the most weight, which is my style of leadership. So that's the biggest surprise, really, for me, confirming what I already have. So
I
thank
tell you,
you.
one of the biggest surprises for me, because it's always a two-way street, when we do these things. And I loved when we did the skills gap analysis. And then you really truly see yourself on a national scale where you fit within the marketplace. And you can see, percentage wise or point wise, kind of where you line it. So some people think, oh, I'm far away from a goal. You might have a nice goal. Your goal was being in the compliance and getting to that, chief compliance officer level. Sometimes we feel like, well, that's a long way off. I have no way, of being able to, achieve that goal. It's a nice to have, but not within my scope, not within my framework of knowledge and experience. But when you work through the skills gap analysis and you begin to truly see yourself in relation to others that are either have on the same road or actually at that role, you then begin to see like, I'm not that far off. You see the observations? You see some of the tactics that you need to get there and what formal training that might need to get to lift you up in certain percentage points and that type of thing. And yours, it came back very, very nicely in those aspects where it kind of really showed me where you sit in relations to others, and it allows me to then deliver a blueprint strategy for yourself that you can deploy over time to get you to your desired state. I think that's wonderful. So looking ahead, you've set some pretty bold, goals toward becoming a chief compliance officer. So what's one skill or mindset, let's say, that you're still working to master before you take that next step?
Thank you, Grant. There are a lot of things to work on, but what I'm really focused on right now is improving how I lead across silos, finding ways to connect departments and build a sense of shared purpose. So it could be a small scale or a bigger scale, but it's all about striking the right balance between humility and confidence, taking time to listen to different perspectives, and working toward cohesion in complicated environments. That's the focus of my approach for now. And true, really, when I started your program, I didn't have a North Star. I didn't have any plan, but thanks to this program, I was able to refocus and know what I want now and work for it. Right? That being and eventually going to be a chief compliance officer. And you're saying it, and that's right. It's a big, bold goal. But with the blueprint that you have provided and helped me with to create. Thank you so much. I'm really uh, positive and looking forward to what I can achieve through that blueprint.
I tell you
Thank
one
you.
thing that really I loved talking to you about. You shared with me your personal story. Say, hey, one of the things that we do in the program is like share, write your personal story, write your how you see some of the pivotal moments in your life come through. And this is how you transfer a lot of knowledge to myself, so I get a better understanding. And then we go through this whole process, from the brand assessment, skills gap analysis to the blueprint strategy. And at that point, I'm able to deliver your actual story in an elevated manner. And when I read that story to you, you said you were emotionally moved by that. It is your story. Tell the audience how you truly felt about that.
For me, that story was ordinary, right? But when it was put, and really I have to step back and hear my own story delivered by someone else, it gave me a different perspective. It really highlighted how I have pushed through and how resilient I was, moving from one country to another um, at that time, and really achieving now what I have achieved through the experiences and the people I worked with. So I would say that that story is so moving to me because now I'm seeing myself that I it was not an ordinary step for me. Although at that time I was just focused on getting from one country to another so that I could practice from the Philippines to the US. And I was just focused on, removing all the stumbling blocks, I should say, in front of me and just overcoming everything that I have to overcome to get to the goal, which is not really far, right? I'm not looking further, really further, but just looking at what's just in front of me to get to that point where I would like to be. But looking back now, I should say that I have achieved so much, and didn't even realize the direction of where I'm going. And if I have to look back to that time where I was, the first few weeks coming from Philippines, I am not imagining myself to be in this position where I am now.
This is wonderful. I'm glad you are sharing that because there's someone right now in the Philippines, in your position that you were in, some time ago. And if that person, now I want you to talk to that person, they're listening, they feel unseen or they feel stuck in what they want to do in their life or in their career. What one piece of advice that you would offer based on everything that you lived, led, and learned so far to give them the confidence to be able to take that leap of faith?
Well, I would say that wherever you are right now, honor that. Progress is not always a straight path, and starting over doesn't mean you've failed. So it's actually an opportunity to grow. Embrace resilience, trust your voice, and don't be afraid to start small. Just like what I did, it was scary, but it's not as scary when you are so focused. I didn't even remember how I have done the things I have done to truly succeed, so that I'll be able to reach the goal of even, for example, preparing for NCLEX and passing the NCLEX. When I came here to the United States, I have to work as a CNA. And from there, I didn't really mind because I was looking forward to the time I will be working as an RN when I passed the NCLEX. So although it was it was hard for me with all the culture to acclimate myself to, I was able to accomplish and overcome that, those even the fears that I have. So I would also say you are capable of more than you realize. And the most thing you can do is keep moving forward one step at a time. So
No,
that's what I
man,
would
that's
say.
great. That's sage knowledge, part of that sage caregiver that you are. I just have one more ask. I have an ask of you because there are so many other healthcare executives that are out here and they've seen my shows, they've listened, they haven't participated. You have been now one to kind of can help them to understand why this is important and what did you get out of this right now? This is your first podcast with me. You've come out, you've done just a wonderful interview. So many people feel like, oh my God, I don't think I could do that. And I'm telling you, you first started out, you're like, there's no way I'm going to be able to do this. And look at you now. You are just fantastic, right? Right? In telling your story, help them understand some of the benefits and how do you feel about the interview you just did?
Well, it made me realize that really there's nothing impossible if you set your mind to it and use the tools and resources that are available to you. So, for example, this program, uh, before I really don't have a direction. I know that I wanted to make a difference and just do my best in my role, but I didn't have a clear plan to what to do moving forward. Um, because I was used to being promoted, I guess, whenever my leaders are, recognize my potential and yeah, you're ready now, so let's move you on, or okay, there's a position that is open. I think it's good for you. But now realizing and seeing what I can do, it's very empowering. So this podcast, it's I have not imagined it because I'm not really a vocal person. I'm usually quiet. So being in a podcast is not in one of my goals really when I joined this program. I didn't imagine that this is part of the program, but I am glad that I got this exposure and to be able to really share my experiences and truly make an impact through my leadership, my experience, and even my personal life. So that's really the ultimate goal here, and not just exposing myself to the public.
Exactly. Thank you so much for
Yeah.
sharing. Now, the public can reach you on LinkedIn. Can you tell them how to reach you on LinkedIn?
Well, you can look me up in LinkedIn, Mavel Arinal, and you will be able to see my profile there and my background, experiences, even my publications, research, and performance improvement projects I had throughout the years.
That
So
is wonderful, Mavel. And
yeah.
thank you again for being on the Follow Brand podcast. I want to invite your entire network and all the people out in the Philippines. I know they're going to be tuning in to this particular episode, that they can see all the episodes of Follow Brand at 5 Star BDM. That is the number five. That is star STAR BDM, B for brand, D for developmentinformasters.com. I want to thank you again for being on the Follow Brand podcast and so thankful for you to be a part of our 5 Star BDM brand development program, the Brave Framework. Thank you so much.
Oh, thank you, Grant. I appreciate you and I'm very grateful.
You're
Thank
welcome.
you.